Hello, everybody, and welcome to Breaking the Stigma, prioritizing our mental health as a community session by Dragonfly Mental Health at Digital Innovation in Mental Health 2021 conference. My name is Jelena Brasanac, and I'm a PhD fellow in medical neurosciences at the Charité University Medicine, Berlin. And my work is focused on the neuroimmunology of depression, stress, and multiple sclerosis. I'm also a co-founder of Dragonfly Mental Health, a nonprofit that is dedicated to cultivating excellent mental health in academics worldwide. Let's take a look at the situation of mental health in academia. So since 2017, there's been several reports that were exposing the situation of mental health in academia. And one of the first reports by Hopkins in 2017 showed that 44% of PhD students experience hopelessness. 36 reported that they are functionally impaired by depression, and 57% said that they were overwhelmed with anxiety. In 2018, followed a seminal paper by Evans et al. In Nature Biotechnology that exposed the mental health crisis in academia and put it in the center of attention of the whole academic community. And this paper showed that around 40% of PhD students experience moderate to severe depression and anxiety. And they also showed that graduate students have 6 to 8 times higher rates of severe depression and anxiety as compared to general population. In 2019, Nature did their annual PhD survey, and there they also asked a question about mental health, and 36 participants said that they sought help for depression or anxiety caused by their PhD studies. So what could be the reasons for these high and shockingly high numbers of people struggling with mental health in academia? First of all, the peak age of onset for most of the diseases is from 14 to 24 years, and this is the time where most people start their PhD studies. According to studies, people with higher IQ are associated with higher rates of self-reported anxiety and depression. As reported in a Nature 2019 study, around 40% of PhDs pursue their projects in countries different from the one of their origin. They're from their home, family, and usual support systems. And we all know how stressful and competitive the academic environment is, and previously diagnosed mental conditions can become exacerbated. And add to that the financial burden and uncertainty about your prospects, staying or leaving academia, and you get a very toxic mix that can barely leave somebody unaffected. This all can be caused or worsened by sleep disturbances, bad diet, and lack of exercise. All of this is showing us that how big and widespread the problem is, and numbers are shockingly high, and sometimes something we cannot ignore but deliberately work to improve. And as a community, I believe we do not want people risking their mental health in exchange for PhD degree. Postgraduate education is very unique and is coming with a holistic set of challenges. Whereas wellness programs showed benefits in the general and undergraduate population, they are not as effective for graduate students, postdoc fellows, or faculty members. Different cultural and systemic barriers prevent people from seeking help. On top of all of that, certain groups experience more stress, which can put them in even more vulnerable position. Women experience more sexual harassment and violence, Black and people of color more racism and discrimination, LGBTQ plus folks, marginalization, homophobia, transphobia. Third generation scientists face economic challenges, disabled scientists, accessibility challenges, and international scientists are faced with different cultural and language barriers. One of the major barriers to seeking help is actually stigma. And this is a very important and great problem in academia. And what does stigma mean for academics? It means fear of professional repercussions, fear of being seen as weak, losing your reputation, and believe that mental illness is not as serious as physical illness. Also feeling that they're not sick enough, on top of other problems and barriers as a lack of resources, not knowing where to ask for help, having heard of previous bad experiences, and general helplessness. So what can we do? How do we make change, and how do we make academia a better place for all of us? We, Dragonfly, are a nonprofit that works to improve knowledge, address culture directly, and build community. And we believe that nobody knows academics as academics. And we have established a global consortium for academic mental health that will conduct research and address systemic issues. We are also building a community worldwide, and we're hosting Dragonfly cafes, virtual events online 3 times per week, where anybody from academia can come and talk about mental health or other issues related to academia. And in the end, most of our programs currently are on-campus programs where we work to create cultural and climate changes directly in academic communities. We host talks, workshops, work on different campaigns that fight stigma, or in collaboration with other allies and people working on improving mental health in academia. And the values that guide us are kindness, active inclusion, open access, integrity, deliberate diversity, evidence-based, and sustainability. And these values are the basis and foundation that help us build our 5 domains of excellence, which map our theory of change. And these 5 domains are departmental committee, peer networks, mental health literacy, fighting stigma, and skills workshops. So sometimes it's the hardest part to know where actually to start, and we recommend starting with establishing a departmental committee that is dedicating to improving mental health in your community. And we provide consulting services to set up these committees or advise committees that already exist in their next steps. And this departmental committee is supposed to keep mental health on agenda. Is supposed to be representative of all levels and identities. It allocates funds, establishes protocol, does yearly evaluation, and has a post-financial plan. Peer networks are peer-run groups that build a sense of community and provide sustained access to relevant resources. They can be at every level within academia, including students, postdocs, faculty, and staff. And we also have a video on YouTube on how to start your own peer network, and also we're open to any questions to help you set this initiative. Knowledge and positive attitudes around mental health are necessary foundation for learning and practicing skills to improve preparedness to recognize, speak with, support, and refer community members that may be struggling with their mental health, as well as advocate for improved communication and accommodation for yourself. And some of our programs include active listening workshops, managing upwards, or Dragonfly Ambassador Training Program. Maintaining mental health literacy is an ongoing process, and we offer a wide variety of evidence-based mental health literacy talks to increase the mental health literacy of all, and especially tailored to the audience at hand. And so far, we have Intro to Mental Health Literacy, Mental Health in Isolation, Scientist's Primer on Depression, and Imposter Syndrome. Many people in academia express fear that if they experience mental health struggles, they will not be successful, or that they will be judged by their peers and mentors. And identifying and directly addressing stigma against mental health struggles improves community support and help-seeking behavior. And we have a unique approach to challenging stigma within individual communities. What we do is we do an anti-stigma campaign where we made a costume film by interviewing members of community who have experienced mental health struggles, and then it is followed by small, large group facilitated discussion. And so far, you can see also on our website a video with Nobel laureate Randy Shackman, who talks about his mental health struggles, and it is the most incredible example how even with mental health struggles, you can be the top scientist, just if there is appropriate help and support. In the end, if you want to get involved, we are really happy to see you either at the Dragonfly Cafe or in our Slack space as a volunteer. You just go to our website and fill the form, then request our programs and services. We're happy to come to your campus or your company, and yeah, follow us on social media, donate to help sponsor our programs, and share and spread the word. Thank you very much.